Hello again, I'm Beth, Diabetes Specialist Nurse at Conquest, and I will be covering HHS for the next session of this educational webinar. So like DKA, which was just discussed at length by my colleague, HHS is a serious medical condition. HHS is different from DKA and the treatment requires a different approach. The person with HHS is often elderly, frequently with other comorbidities, and is always very sick. Though typically occurring in the elderly, HHS is presenting in even younger adults and teenagers, often as the initial presentation of type 2 diabetes. It has a higher mortality rate than DKA and may be complicated by vascular complications such as MI, stroke, and thrombosis. Whilst DKA presents within hours of onset, HHS comes on over many days, and consequently the dehydration and metabolic disturbances are more extreme. So a precise definition of HHS does not exist, but here are the characteristic features that differentiate it from other hypoglycemic states such as DKA. So these characteristics, such as they will present with hypoglycemia, usually above 30 millimoles per litre. The majority of these patients will present with no ketones. They will have no acidosis, and the hyperosmolarity will be above 320. So these characteristics are the criteria for these patients being treated on the HHS protocol. So this slide further highlights the differences between DKA and HHS, and just to highlight further again that the mortality rate is very high, and therefore treatment must be prompt and accurate. So what causes HHS? There's a long list of causes, but mostly infection would be the main cause. We also see some drugs that will bring on HHS, such as steroids. It could be, like we said before, a new presentation of diabetes and poor treatment concordance with the patient. So the signs and symptoms of a patient who is in HHS, they'll be dehydrated, hypotension, decreased urine output, and decreased conscious level, and features of whatever the main cause is. So they might feel weak and experience muscle cramps and vomiting, polyuria and polydipsia, and an altered mental state. So our goals of treatment of HHS is to treat the underlying cause and then to gradually and safely normalise the osmolality. So we want to replace the fluid and electrolyte losses and normalise their blood glucose. So vigorous initial fluid replacement will result in the decline of the plasma glucose, and patients with HHS may be have up to 9 litres of water deficit. So the rate of rehydration will be determined by assessing the combination of initial severity and any pre-existing comorbidities. So caution is needed, particularly in the elderly, where the too rapid hydration may precipitate heart failure, but insufficient may fail to reverse acute kidney injury. So our other goals also to prevent arterial or venous thrombosis and other complications such as cerebral edema and foot ulceration. So to manage the patient with HHS, same as the DKA, excluding the fixed rate. So they may need IV insulin, but only in the presence of significant ketonemia. So the rehydration itself may reduce the blood glucose levels. So we want to consider full heparization to reduce the risk of thrombosis, and we want to look at treating the precipitating cause. And like I said before, caution with the age and comorbidities. So to use the intravenous fluid of 0.9 sodium chloride solution as the principal fluid to restore circulating volume and reverse dehydration. And the fall in blood glucose should be no more than 5 millimoles an hour. So IV replacement fluid aims to achieve a positive balance of 3 to 6 litres by 12 hours and the remaining replacement of estimated fluid losses within the next 12 hours through complete normalisation of biochemistry, which may take up to 72 hours. Once the patient's osmolality is resolved and they are able to eat and drink, then they can be considered for coming off the IV fluids and exit the criteria. So the patient may need to be reviewed upon this point to look at treatment for the patient ongoing for their glycemic control. So please refer to the diabetes team at the earliest point. Thank you.